www.healthcmi.com. Acupuncture Continuing Education Online today. Acupuncture alleviates depression and benefits the brain. This was published in the healthcmi.com news site on September 20, 2018. Really interesting stuff. Let's take a look. Acupuncture restores brain connectivity and benefits patients with major depression disorder, MDD. Using functional magnetic resonance imaging, that's fMRIs, researchers at Guangzhou University of Chinese Medicine Hospital document that acupuncture significantly increases the connectivity of the corticostriatum to other brain regions, an important brain circuit connection involved in rewards and motivation. In the same investigation, 8 weeks of acupuncture treatments significantly decreased depression scores. Based on the MI results and clinical data, the Guangzhou University researchers conclude that acupuncture regulates corticostriatal reward and motivation circuitry and improves patient outcomes for patients with depression. If you'd like to read and take a look at this article, go to healthcmi.com, click on News, and take a look at the article entitled Acupuncture Alleviates Depression and Benefits the Brain. In traditional Chinese medicine, we know that whether depression is caused by a physical issue or starts as a mental trauma, it eventually leads to physical changes. So what we want to do is help balance the brain, help balance the neuroanatomy. And what acupuncture has been shown to do is restore connectivity between different brain regions in fMRI scans. So this article will give you a lot of specific results. Again, at healthcmi.com, we have many articles on exactly this topic, showing how acupuncture restores connectivity between different brain regions. Essentially, the human brain has many different regions that operate for different tasks. So one of the main resting states is called the default mode network. Now, the default mode network is when the brain is at rest, and this is very important so the brain can relax. So when a human is not really thinking about any task, in other words, we're not writing with a pencil, we're not composing music, we're not throwing a baseball, we're not trying to do or accomplish something or make a list for things to do that day, we're just, and not necessarily spacing out, but simply relaxing and not focusing on accomplishing something. Different areas of the brain are active at that time, and other areas of the brain are inactive. And this is across the board the same for all humans that have a healthy mental emotional state. And when we're active, when we're dancing, or when we're writing, or when we're focusing on running, or different activities, for example, other areas will be active and other areas will be inactive. So there's a complex for each type of activity. And again, this is a commonality across all humans. However, when there is depression, at the rest state, some areas are hyperactive when they should be at rest, and other areas are not active at all when they should be active. And in other areas as well. And this is a problem because the functional connectivity is disturbed. And what acupuncture has been shown to do is reset that normal connectivity state, which gives people fighting depression a chance. Because if the brain cannot rest, it's hard to restore and recover. If the brain cannot focus properly, it doesn't give someone a chance to work through those issues. Acupuncture is not talk therapy. It's not going to get people through the processing necessary. Acupuncture is not a drug. It won't stabilize someone in an emergency the way some drugs might be able to. What acupuncture can do is physically restore the brain. And I like to say it's like a reset button on a computer, almost like, well, everything's going wrong on my phone or my tablet or my computer. Maybe I should restart the thing and reload. So what happens is during the acupuncture treatment, patients relax very deeply and the functional connectivity starts the process of being restored. Now, this is not something that happens overnight. This would take repeated treatments. But it is definitely one element in a regimen of care that can help people with major depression. And this article gets into specifics about this situation. So again, visit healthcmi.com and please learn more about this topic. I'm Adam White, licensed acupuncturist. For the Health CMI News Team, thank you for listening. www.healthcmi.com.